Hi everyone. Thank you for taking a few minutes to watch this video presentation. I wanted to provide you with a quick recap of the feedback we received at our first Advisory Council meeting on May 28th and an overview of work done since then by the working group to review, revise, and really pare down our list of metrics to the list we are presenting to you in the online survey for voting and feedback. I will also briefly cover some basic principles and instructions to guide you as you work through the survey and outline next steps once results of the survey are analyzed. The first important piece of feedback we received from stakeholders on May 28th was overall endorsement of our proposed process. Our ultimate aim on the far right of the screen is to come to consensus on a list of 15 to 20 high priority indicators for measurement. We will use a modified Delphi method, essentially sequential iterations of voting, ranking, and revision of candidate measures to achieve stakeholder consensus. The Advisory Council also endorsed a first-pass evaluation of candidate measures by the working group on the basis of explicit and agreed-upon criteria, with a view to remove measures up front not meeting these criteria. A critical change to our original proposed process that was recommended was to focus on cross-cutting measures and remove tumor-type specific measures, with the understanding that future work would look to tumor teams to facilitate the development of these. Truly, our first pass was indeed many passes, many hours of discussion, culminating in the paring of our original list of nearly 550 metrics to the 110 that remain for consideration in our first round stakeholder survey. As we consider prioritization of measures, it is helpful to orient our thinking based on the overall stated project mission. That is, the development of a suite of indicators for measurement with the goal of identifying potential gaps to drive learning and support quality improvement efforts. We are not looking to develop a balanced report card or to measure things we know we do well, but rather to study processes and outcomes where we think we likely can improve. Using these measures, we can then test interventions and monitor improvement over time. Criteria used for our first pass evaluation are listed here and should be kept in mind as you work through the survey. Some metrics, as they are written in the survey, have been worded as concepts and thus may not meet the criteria of being a well-defined and objectively quantifiable measure. We have intentionally left these written as such, as in some instances we found groups of very similar indicators that may be of importance. In subsequent live virtual meetings, there will be ample opportunity to discuss surviving metrics and revise or reword them. Within the online survey, there is also opportunity for you to provide feedback on additional specific measures you may wish to recommend. Measures should be actionable within CCA programming, and process or outcome-based measures are preferred, given that structural indicators are more fixed and involve longer-term change. Indicators should align with at least one of the 4 goals of the AHS quadruple aim. That is, firstly, to improve the experience of patients and families, to improve patient and population health outcomes, to improve the well-being and safety of providers, or to optimize value and efficiency. The 110 metrics surviving the working group's first pass evaluation have now been built into an online SurveyMonkey for full stakeholder review. As a reminder, our stakeholder group includes broad representation from across the province, with representation from clinical and operational staff, from both tertiary and community sites, as well as patient representatives. Each of you brings unique and valuable perspectives to this process, and your feedback is invaluable. We anticipate that completion of the survey should take you 30 to 60 minutes and sincerely appreciate your time and engagement in completing this at your earliest convenience. The survey has been organized by quality domain, with each metric categorized within one domain. In doing so, there were occasions where we debated which domain a particular metric may represent, but ultimately had to select one. Again, there will be ample opportunity within both the survey and at later meetings for you to provide feedback if you feel a metric should be categorized differently, and to suggest additional measures you feel should be considered for a particular domain. The CCA Quality Matrix is included as an email attachment for your reference, as well as a glossary of terms including the definitions of the domains of quality. Further, the domains are described and defined within the survey itself. At this time, we are not asking that you rank metrics relative to one another by order of importance, but rather to consider each individual metric for its importance for inclusion as a priority, quality, and safety indicator. You will rank each metric on a Likert scale from 1 to 9, with 9 indicating that this metric is high priority for inclusion and 1 not high priority at all. If you feel you are unable to rank a metric due to lack of familiarity with the concept or lack of knowledge or expertise, there is an option to abstain as well. The criteria listed on this slide will be used to determine which measures will survive this round of voting, to be brought to our next meeting for further discussion and ranking. These criteria are based on previous published work by Britta Danielson and thus consistent with previous work within our organization. At this point in the process, please vote based on metric importance for inclusion, not on feasibility of the metric. Technical feasibility is, of course, an important consideration and will likely factor into our live discussions and subsequent iterations of voting. As we do not yet know the full data capabilities of the future Connect Care Epic environment, the feasibility of specific metrics is difficult to fully assess. Once we have reached consensus on a list of 15 to 20 indicators, we can then work with surveillance and reporting to determine how to operationalize these as we launch Connect Care in the spring of 2022. It is conceivable that some of the indicators we select will not be technically feasible at this time. The NCCN, in undertaking a similar process of indicator development, describe a similar outcome, with a handful of measures felt to be of priority for measurement remaining as areas for future development. Our next live meeting is scheduled for September 15th. Thus, the deadline for completion of the online survey is August 31st to allow the working group enough time to analyze results and prepare for further discussion and live voting. As noted, we anticipate you will require 30 to 60 minutes to complete the survey. If you are unable to complete it in one sitting, you will be able to leave and later resume the survey where you left off. Survey results will be completely anonymized. However, the survey will have the ability to collect names for the purposes of determining rate of survey completion and to allow us to send out reminder emails as the deadline for completion approaches. Thank you, everyone. I sincerely appreciate your time in completing this survey. I hope everyone's having a wonderful summer, and I look forward to connecting again in September to review the results of the survey and enter into further discussions as we work towards consensus on our list of metrics. If you have any questions at all, please feel free to reach out to myself or to Amy Cantor.